Welcome to the Virtual Integrated Patient platform. It is a program that we created that can generate a wide variety of patients with differing conditions and symptoms, ethnicities, genders, and ages. When you start a new case, the system generates a new patient for you to interact with. At the center of the window, there is a box with the heading Interview. This is where you will be chatting with the patient. The chat box will give you a brief outlook of the patient. Once the chat box appears, you may start to ask the patient questions. Here are a few tips when asking the patient. 1. Make sure your questions are easily understood. 2. Try to minimize your typo errors. 3. Avoid using abbreviations or short forms like how you normally would with a friend, as the system might have trouble understanding what you are trying to convey. Let's begin chatting with the patient. It is always a good practice to first greet the patient. We then verify the patient's name and ID. After these first two steps, we can start getting into the interview. During the interview, you can keep the conversation going for as long as you would like and ask any question that is of relevance, such as the patient's medical history, family history, etc. Let's move on to the next part. On the bottom left side of the page, there is a box with the heading Case Notes. This is where you can note down the information you obtain through the interview with the patient. If you are ready to examine the patient, you can let the patient know by typing in the chat box. It is always a good practice to ask the patient for permission to examine him or her. After that, an anatomical representation of a human body should show up on the area the chat box was at. This is the examination module. You can hover your cursor over the area you would like to examine and click on it. This box is where you specify what you are examining the patient for. If I'm examining a patient's lungs, I would want to know information such as the breathing sound. At the bottom of the dialog box, you can enter case notes from what you gathered. If you have any other questions that you would like to ask the patient, you can click on the interview button, which will bring back the chat box. After that, you can notify the patient if you want to conduct a clinical investigation. After the patient agrees, you will be directed to the lab test module. In the lab test module, you must be clear on what you want. For example, the patient's total blood count, and the test will be shown on the box. Once you have requested for the lab test, the results will be saved under the patient's medical records. When you have obtained enough information and think that you're ready to diagnose the patient, click on the Ready to Diagnose button at the bottom. In this dialog box, you are supposed to summarize all the information you have gathered from the patient. After that, click the Proceed button on the bottom right corner and you can give your diagnosis and then click on Save and Proceed. Finally, you can provide the patient with the appropriate treatment. Once you finish giving the treatment, the model answer will show up with the information about the case. On the panel on the left side, you can review what you have done, compare it with the correct answer, and what you can improve on for the next case. After that, you can click on Save on Exit. However, if you want to start a new case, you can click on the Fresh Case button. You can do this as many times as you want. That's about it for the Virtual Integrated Patient platform. Thank you for your kind attention.